The music has stopped. Good evening, everyone. My name is Dr. Valencia Walker, and I am so excited that you are joining us this evening to kick off Black Maternal Health Week 2024. I am in a very enviable position as president for Birthing the Magic Collaborative and partnership with several other amazing organizations. Dr. Shalon's Maternal Action Project, Melanated Moms, and Black Coalition for Safe Motherhood. We are bringing you an incredible week of programming that you can access completely for free. But what was really important for us was to start off tonight really breaking down what people think they know and highlighting the amazing work that these women that you're going to hear from tonight are doing to show you that we are not just statistics, we are not just a hashtag, and we are just not another tragic news story that you hear, that we are doing things to change our directive, to change the narrative, and most importantly, to empower each and every one of you, not just for yourself, but for your family members, for your friends, for your loved ones, and of course, for our communities. Now, I'm not allowed to talk long because when I tell you that this group of women that I learned are also friends, because you know that bosses run together. They do not, it's a natural attraction. So they have so much that they're going to share with you. And what we've decided to do is because you may not know them as well, is to have each one of these amazing women introduce themselves and the work that they're doing before we go on and really start getting into the questions that you got here. So with that, I am very pleased to turn it over to, oops, I lost my show. Coming back to it because I was told I have to go in order. Ms. Irving, I'm so happy to start with you and have you introduce yourself and talk a little bit about your work around Black maternal health.
Thank you so much, Dr. Walker. My name is Wanda Irving, and I am forever the mother of Dr. Shalon Irving. I'm honored to be on the stage with such phenomenal women as we discuss the devastating crisis of Black maternal health. In 2017, my dear daughter fell victim to the same health inequities she fought so hard to eliminate. Shalon was my baby girl, born between two brothers that she adored. She was brilliant but humble, accomplished, and yet she was so accepting of everyone she met. She was a skilled professional who knew exactly how to make everyone feel welcome at the table. If you were fortunate enough to have known Shalon, you knew her to be a well-respected epidemiologist at the CDC, an exceptional speaker, a gifted writer, and a fiercely loyal and loving friend. We all were truly blessed to have experienced her warmth, her kindness, her sense of humor, her smile, and her laughter. Her life was really cut short because of systemic racism, and it runs rampant in this country, rampant. The implicit bias that allowed her healthcare providers to dismiss and devalue her, the implicit stereotyping and prejudice that caused her pleas for help to fall on deaf ears. It was for those reasons that I founded in 2020 Dr. Shalon's Maternal Action Project, which is a 501c3 nonprofit dedicated to reducing the continually rising maternal mortality rates, especially among Black women. Though we are still a relatively young organization, I'm very proud of the work we have done, like creating the Believe Her app, which is a peer-to-peer platform for Black women to find vetted information, access to doulas, resources, and a sense of community, among other women who have been in their shoes. Since emergencies don't occur only between 9 and 5, Believe Her is available 24/7 in over 54 languages. I'm especially proud of the work we are currently doing, like launching Grandmothers Rallying Against Maternal Mortality, which will provide a network for grandmothers like myself to find answers and community while redirecting our grief into action. Also, the work that I'm doing with the National Collective to produce Speak, Move, Change and the National Postpartum Week. I'm also proud of the work we are engaged in with Dr. Natalie Hernandez at Morehouse School of Medicine as we seek answers to preventing nearly fatal experiences for Black women. I'm most excited about the research we plan to identify strategies that will identify interventions to ensure that children of lost mothers get the care and support they need to strive and thrive. Our work at DSMAP is personal to each of us. We're guided by Shalon's personal and professional mantra. I see inequity wherever it exists. I'm not afraid to call it by name, and I work hard to eliminate it. I vow to create a better earth. We envision a world where everyone takes this vow.
Thank you so much for those powerful words and for the amazing work that you've done and continue to champion. And I really appreciate that idea of persistence, and knowing that we can never just think that this is something that we can not pay attention to. As we've seen with this year, that people are willing to take away those things that we know we need to be protected. So at this point, I want to turn it over to Ms. Shawnee Gibson, because I think the work speaks well to complement what you've already introduced to us. I don't see her on the call. We may have lost her. And so what we'll do is that we will move to our next speaker, who will introduce herself. Kimberly Steele's Adams. And I think I can't wait to share some of the work that she's talking about with you.
Thank you so much, Dr. Walker. Good evening, everyone. My name is Kimberly Sales-Allers. I'm the Executive Director of Narrative Nation. We're a New York City-based technology and media nonprofit. We create technology platforms and media products specifically to address racial disparities in maternal infant health. I'm also the founder of our signature product, the Earth app. That's like the word birth, but we dropped the B for bias. Earth is the first of its kind Yelp-like tool designed just for Black and brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. We are all about crowdsourcing and publicly sharing where we're getting good care and where we are not. On the back end, we turn our anonymized reviews into data, powerful data, to work directly with hospitals, payers, and providers. And what could we learn by learning and listening to the living instead of waiting for another senseless and tragic maternal death to recognize that there may be gaps in care or even bias on hospital teams? So I'm proud that Earth is now working with hospitals and health systems in 8 states, and that we are consistently really trying to hold systems accountable of all the things that are happening as we celebrate Black Maternal Health Week. For us, holding health systems accountable for the ways that they treat Black and brown women and birthing people is a critical piece of what we try to do. And I think what's related to that for us is this idea and this mandate that we must raise the bar. Because as much as we want to end mortality, Black maternal mortality and morbidity, we know that that is not the only goal, right? Just because we didn't die or nearly die doesn't mean we had the experience that we deserve. And so we want to make the 5-star experience the actual standard of care and then hold hospitals accountable to that, right? And that we could actually create a community-centered accreditation tool. We're looking to build out our first Earth-approved hospital that's going to earn different levels of our accreditation, and really push for systems change that is community-driven, that is community-rooted, and also pushes really big for community accountability. I'm also real excited to stand here today, joining you from New York City, where the mayor of New York City declared today, April 11th, Earth Day in New York City, as the kickoff to Black Maternal Health Week. So we had a big Earth Day celebration and a multi-borough activation as we celebrate the role of birthing without bias as a human right and as the right of every Black and brown birthing person. So I'm super excited about that work. Secondly, I will share that in addition to the Earth app, the Narrative Nation, we also produce the Birthright podcast, where we only share joyful Black birthing stories. And I started Birthright back in 2020 because I was deeply concerned about the narrative in Black maternal health, which was overly focused on doom and gloom, sensationalized headlines, and really wanted to center the joy. How could we learn from positive experiences? And so we do this on the Birthright podcast. I'm excited that we're now about to start season 3. After season 2, we created an instructional tool. I brought in a team of qualitative researchers and I asked them one key question. What could doctors and nurses learn from Black birthing joy, right? Because they're so used to learning from our death, our demise, our despair. And so what we've created is an important instructional experience for doctors and nurses. And we also have the Black Birth Joy Line, which is a free number that you can call to hear clips from the podcast, and really experience that Black birthing joy is possible. And we must shift that narrative as well. So I'm excited to be here, as mentioned, with my friends, my co-conspirators in this work, and excited for an interesting conversation.
Thank you so much, Kimberly. And I asked her earlier, she is a Kimberly, not a Kim, because I have Kims in my life and I have Kimberlys in my life, and they make sure I remember the difference. But I really love the work that you do because I think sometimes, particularly for me as a physician, I am terrible at communicating what I do. And the way that you're able to use your work to amplify these stories, sometimes we don't know what's supposed to go right. And I think we're just so used to, I'm going to be mistreated. They're not going to listen to me. And knowing that you can have joy and that you're supposed to have joy and that we have joy is incredibly powerful. And as you were talking and talking about the different work you do, I realized that is our story as a, as a Black community. We're not a monolith, but as a Black community in the United States, we have always found ways to communicate our truths, be it in the way we style our hair, in the way we follow the stars at night, and now the way that we do podcasts. So thank you so much for your work. I'm so excited. Shawnee made it back on the line. I thought I was going to be the only one with technical difficulties. So I do want to go back to her and allow her to introduce herself.
All righty, greetings. There are never ever difficulties, right? Everything happens for a reason. So family, thank you for having me. Esteemed leaders, sisters in this work, I'm so grateful to you and for you because we can't do this work without one another. I love that we have activated the spirit of Ubuntu. I am because we are in this space. So greetings to all, no matter where you are on terra firma. I'm Shawnee Renee Trellis Benton Gibson. I am the co-founder of the ARIA Foundation, and ARIA stands for the Advancement of Reproductive Innovation through Artistry and Healing. I am an artist unapologetically, and I bring it to everything that I do. I'm a licensed clinician, psychotherapist. I've been in the field of social services for over 33 years, and I have the privilege of working with women and birthing people from all over the land, supporting them and being able to utilize their voices to activate their autonomy, to bring the tenets of reproductive justice and social justice and anti-racism, Black anti-racism alive, so that we can survive and thrive in this world. I'm also unapologetically straight about what the source of these issues are. And I speak explicitly about white supremacy culture, anti-racism, patriarchy, and capitalism. I talk about them as being the triplets that impact our well-being every day. And so the ARIA Foundation is committed to cultivating and curating events that operate from a space or that are designed to manifest cultural experience, spiritual experience, a holistic experience for us to know and understand that all of our intelligences support us in this work. I also have a Motherwick conference that I do annually, and we're approaching the 10th year. And what I'll say about that, like a bridge, is my daughter passed away, Shamani Kiba Gibson, in 2019 due to a birth-related pulmonary embolism, and her death was preventable. But that was 4 years ago, and I was in the work a decade or plus before that. So just thinking about the fact that with all the knowledge that Shamani had by virtue of me being her mother and her being a part of those events and talking about women's issues and our wounds and our sexual and reproductive health all the time, that even with all of that knowledge, she still passed away and the system failed her. So I want to talk today about what we can do to transform systems and to take responsibility for our stories, the joyful ones and the traumatic ones, because all of them fuel who we are. And thank you for allowing me to be here once again.
Absolutely. And I think, it's very telling that you continue to persevere in this space and to take that trauma and not let that trauma be the end, but to propel you forward into those next stages. And I want to say that I see you and I value you and I appreciate you for that. Thank you so much for sharing. Listen, I tried to tell you all that they were going to bring it. I mean, they're showing up already with so many tools and resources for you before we even get to the questions. But we have a few more people to go. And so, Ms. J. Wilson, will you please introduce yourself to our wonderful audience?
Sure. Good evening, good morning, good afternoon. I'm not sure where everyone is, but I'm very excited to be here. My name is Jay Wilson. I'm the founding president and CEO of Melanated Moms. We are a mom profit, not a nonprofit, but we are a community-centered women empowerment organization that primarily creates spaces for moms, women, and birthing people to achieve maternal health equity. And that's through community engagement events, that's through public policy and understanding how advocacy fuels our ability to connect to the resources that we need, including one another. And we also have a great mom community where we pour into each other. And we understand that in order to uplift our moms or other mothers, we have to build as we climb, right? We have to understand the complexities of the things that they go through their journey from womanhood or individualized as a person to motherhood or into being a parent. Outside of that, my background is in nursing. I've been a LPN for 20 years, primarily worked in community health with the LGBT community. I have an extensive background understanding how marginalization really impacts patients' health. And I've incorporated a lot of those concepts and those key lessons into the building of my organization, Melanated Moms. I am also a mother. I'm a mother of 2 living children. My girls are 15 and 12. I am also a stillbirth mom, and I am a 4-time survivor of preeclampsia. I had no idea that my experiences through those journeys and through those traumas and those incidences would actually help me to understand the need for me to form my organization. But I am very intentional about the work that I do now that I know that this is my purpose. And I am also just as passionate about bringing in more moms, women, birthing people, and fathers into these kind of conversations and into these spaces so that we can amplify the messages that need to be said and tell the stories that people don't often get to hear. Outside of that, our work has really been driving so many different ways of understanding those areas where inequity has taken away lives or taken away the voices of families. Most notably, our work with the governor of New Jersey and the Nurse New Jersey plan has really helped to strategize how we can activate the families' voices. And our signature advocacy training, Find Your Roar, has really helped to not just give the tools that people need in order to publicly speak about their situations and their circumstances, but actually connect them to understand how policy influences the resources that they have access to. So I'm incredibly excited and honored to be here, and I hope to really be able to contribute some great things to this conversation. Thank you.
So, my mom, the one thing that I can promise each and every one of you here is that she does not play when it comes to her children. As a neonatologist, one of my very old school neonatologists told me, you can do anything you want, but don't come between the mama and her baby. And so I think the power of bringing mothers together the way that you do, and those birthing people that are going through a parenting experience, there's power that you can tap into. And that's how, again, you make all these amazing connections to other organizations because everyone can share, this is what I know, this is what I've experienced, and this is how we continue to build each other up. So thank you so much, Jay. As you can tell, we wanted to make sure that you heard from a lot of different perspectives. We've got your tech and your apps covered. We've got your family and moms. We have your narrative, making sure your voice is heard and that you hear the joy that comes with it. And we have those experiences of the extended family, the grandparents. So as one of the physicians in the group, my voice is one of the least important. But I will say I have an amazing partnership with OBGYNs, and I'm very pleased to allow our next speaker to introduce herself and how, for many of us as physicians, are starting to see lives where we advocate and work with these other amazing advocates as co-conspirators, as you heard, to really move these steps of forward. So, Dr. Kirby, I'll turn it over to you.
Thank you. Thank you for all of the attendees for being here. I'm Leslie Farrington. I'm the co-founder, and you can click the slide again, co-founder of Black Coalition for Safe Motherhood, and I'm the co-creator of the ACT curriculum. I'm also retired, and I think we skipped a slide. If you could go back, go back a little bit more. You're going forward and not back. Oh, we lost a slide. Okay, that's okay. So I am the founder, as I said, of the Black Coalition for Safe Motherhood, and I'm co-creator of the ACT curriculum. Now, I'm also a retired Black obstetrician. I am Black, and although I had a slide of my picture of my parents, my father was a dark-skinned man, and he instilled in me my identity. And being the daughter of an interracial couple, I learned about racism from an early age. We know that racism is the cause for poor health and unsafe and traumatic healthcare experiences. So that's why we started the Black Coalition for Safe Motherhood to spread ACT in Black communities nationwide, because we hope to equip birthing individuals and supporters with a self-affirming and potentially life-saving toolkit to more safely navigate pregnancy, birth, and postpartum. So ACT stands for the powerful steps you can take to get the care that everyone deserves. Ask questions until you understand the answers. Claim your space, both physical and mental. That's your bodily autonomy and your dignity and self-determination. Trust your body. You know your body best. Don't let anyone dismiss your symptoms. Tell your story. That means making sure that if you have concerns, about your health, your pregnancy, etc., that you make sure that your voice is heard. And sometimes that means getting support to do so because of the dismissal, the devaluing, etc., that goes on in the healthcare industry. So I want to emphasize this one point. We all need an advocate or supporter by our side, either in person or on the phone, in hospital settings or doctor visits. That way we get help to ask questions, claim our space, tell our story, and get the care that all people deserve. So our ACT workshops are small gatherings of 5 to 15 people who role play their responses to challenges in healthcare interactions. The idea is to practice taking charge of your care or supporting others to take charge of their care. And there are no wrong answers in the ACT workshop. It's led by a trained facilitator who actively listens so they maintain a supportive and non-judgmental atmosphere. We learn in our workshops by supporting each other and listening to each other in the spirit of Ubuntu. I am because you are. That emphasizes our shared humanity. Next slide. Now, our workshops are a forum of sharing skills and knowledge about how to advocate for oneself and others in healthcare settings, but we also talk about support, support from family, friends, and coworkers, church members, your village in essence, because support, holistic support, can help heal the health impacts of growing up Black and living while Black in America, which can cause high blood pressure, premature births, postpartum depression, and other medical and maternity problems. So these are interactive programs, and we're going to do a little bit of that interacting in just a moment. So let's go to the next slide. Here's a sample of what goes on in an ACT workshop. Please put your answers in the chat, your responses, so others can learn. This is what we do in the ACT workshops. We listen to each other, so we learn from each other. What do you say when the answers are not clear? When the provider is speaking too fast or using medical jargon? Suppose they're rushing you. How do you slow them down? Suppose you are being dismissed or disrespected. What do you say to them? How do you let them know? And what about if you disagree? And we have a right to disagree. We have a right to refuse recommended treatment. And being pregnant or birthing does not impinge on those rights. And in fact, I'm going to enter into the chat 2 bills of rights that I think are very important. We share these after our ACT workshops. So think about what your answers would be, what you would do in these situations. And in these situations are also amplified by using actual scenarios, such as what do you say or do if you're pregnant, you're almost due, the doctor wants to induce you. You don't want to be induced. What do you say? How do you respond? And sometimes you often will need the support of family members or a doula to help you be firm about honoring what you prefer and what you need and what you value. So that's basically what goes on in a workshop. Next slide. After the workshop, the participants have been completing surveys, and 95% are more confident in communicating with providers and asserting their rights. We have facilitators now in over a dozen metro areas. There are around 60 of them, and it's growing because we now have ACT facilitator training. Anyone can attend an ACT workshop, anyone in the community or anyone who's supporting the Black community, the birthing community. But for ACT facilitators, we hope that those who want to educate and advocate in the Black community, doulas, childbirth educators will join us with this new training. It's online, it's self-paced. We have a wonderful instructor who's also the coach of engaging the community. And her name is Portia Holland Otumba. And so we hope that you'll join us if you're inclined to spread ACT to your community. Now, we know that as Kimberly says and others say all the time, we need doctors, nurses, hospitals to be accountable, to be held accountable for the problematic care that they're giving. We know that medical professionals, healthcare institutions must do better, must value Black lives. But until we see an end to the racism, the paternalism in maternity care, and medical care in general, until we see that accountability, the transparency, the care that everyone deserves, we need to act.
Thank you so
And
much.
I'd like to quote
Dr. I'm so sorry. Can
I'll
you
stop there.
Yeah, I was going to say, because there were a couple of comments in the chat, and I think those questions and comments are a perfect way to launch into the discussion that we wanted
That's
to
good.
have among all of us. So
Okay.
I started off by before I introduced Dr. Farrington, joking a little bit about like how physicians talk, and how we talk is not how the rest of the world talks. So part of the point of this conversation amongst this group of friends is to give you the real. And what I often tell people, and I never mean it in an offensive way, is learning to speak another language. Because I have often had friends when I'm like, when the doctor comes back in the room, say these words, say them in this order, because this is the response you should get. And so I want to make sure we kind of walk through some of those things on an individual basis. But then, as several of our amazing panelists have talked about, we can't bear all the burden of what needs to change, but we can push the institutions to do the change that we need. So we're going to try to balance between those two things with our discussion. We do have a Q&A feature. Please feel free to type questions into the Q&A. We'll see those and acknowledge them. If it's easier for you, you can also type questions into the chat, and we'll highlight those as we get to them. And so I want to maybe slow down and start with, and I'll start with Kimberly, and some of the work that you do. What have you found in terms of communicating these issues? What have you found has been the most effective that connects us and the healthcare system to be on the same page?
Yeah, that's such a great question. First, I want to lift up that at times, what we're learning in our Earth App reviews is that advocacy is a privilege, right? And that sometimes our users are reporting that when they do speak up for themselves, they feel like they are treated even more harshly because they actually are knowledgeable. And so we know that racism and bias even impacts our advocacy efforts, right? And so we see this too often in our Earth App reviews where people are asking questions, they are saying the things, and this is not being welcomed by physicians. And so, my question is always around what do we need to change so that our advocacy is actually welcomed and not viewed as a threat, or that people aren't being retaliated against because they actually have voice and language and tools to advocate for themselves. So, and that's the work that we do, really trying to address some of that bias on the teams, which makes people not responsive to the very important advocacy that is coming from that birthing person. And so this is a big thing that we're learning about that part of communication, the ways that one of the things that we're also learning is how powerful, as we know, that doulas are in their advocacy, the ways that they can support a birthing person around that time, particularly since, when you're pushing out a baby, it is not the time you're going to be remembering or thinking about all the things that you may want to say or need to say. And so really trying to appreciate the role of doulas, not just at that birth experience, but also prenatally as an additional communicator, as an additional person who can advocate on that birthing person's behalf. And then it's about understanding the behaviors, right? What is it that people are actually advocating for? Is it that they are saying that they are in pain, right? Right now in the Earth App, in our national database, my pain levels were dismissed as the most reported negative experience. We have reviews from 46 states and over 20,000 users, right? But my pain levels are dismissed as the #1 reported experience, negative experience, I should say, in Earth App. #2 is I was asking for help and it was ignored or refused. #3 is I was scolded, yelled at, or threatened. Right. And so again, when we understand the true nature of the behavior that Black and brown birthing people, particularly Black folks, are experiencing at the hands of healthcare professionals, then we can develop the kind of tools that Dr. Farrington's talking about, those that are deeply rooted in our lived experience. And that's going to help us become better communicators and to establish our presence as people who not just will advocate, but will report, right? The advocacy is one thing, but reporting and documenting is another big part of that.
Thank you so much. I want to flip maybe to Jay and ask, particularly as you're thinking about how mothers are talking to each other, right, and sharing some of this, what you have found that people have reported recognizing as Black women, we quickly become threatening, so what has kind of helped maybe deal with some of that pushback or defensiveness or mistreatment that might result from advocacy?
Yeah, that's a great question. For me, the biggest thing that's come up in some of our groups is not knowing that they have permission to say things out loud. And then just getting the reassurance from the other women in the group or the other birthing people saying, yes, it is safe. It is okay for you to say these things. And also just validating that these things are not like gaslit or it wasn't just them that experienced it, right? So taking them out of the space of being isolated or thinking that I'm the only person that has ever experienced this, so I don't want to rock the boat or I don't want to cause trouble. But again, giving them the validation of, yes, you are valid, that absolutely happened to you. I understand what that feels like, and you don't need permission to say these things out loud. And that gives them the comfort that they need to keep pushing forward. Even just today, this morning, we did a press conference in Buffalo, New York, and there was a young lady who talked about how important it was for her to ask for the help that she needed, but was unable to ask her initial community, like her close-knit family. And she found the program that we were working with there, and she took our Find Your Word training, and she was like, I couldn't even be standing here today to share my story if I didn't find this resource, if I didn't have the ability to connect the dots and know that it was safe to say these things out loud. I thought I had to keep it within me. So we're seeing this stuff in real time of people being empowered and feeling comfortable and saying these things out loud, but also knowing that there are so many other people that can share that experience with them and not belittle them or minimize their experiences, but actually uplift them and hold their hand so that they know that they're not alone to address those things.
Thank you so much. I think, we often feel like, oh, I'm going through this, I got to power through. And often we feel so alone. And I think one of the things that's really important through what we're hoping to accomplish with Black Maternal Health Week and bringing together all of these amazing women and the amazing organizations is to build a network and a community everywhere. You should not be going through a birthing experience alone. You have your doulas, but you have your family members and loved ones and partners that can be there with you as well. Again, we mentioned there's more to the story than just that. And so I see Shawnee jump. She knew I was coming to her, I think, because she started nodding her head. So Shawnee, I wanted to flip it over to you, right? So there's what we do on our side, and then there's the system side. And I will add my 2 cents after you finish.
So I want to actually point to something that's in the chat. There was a request, I think, from 2 people for us to share in layman's terms, lay women's terms, lay person's terms. And I think part of what the system does is creates this jargon that folks, lay people, can't understand or navigate, or they do have an understanding of it, and then they have to play the jockeying and the negotiating with the provider. And sometimes providers get offended when you show up with knowledge. It's like, this is not a personal affront against you. This is me operating from my sense of balance and understanding of myself, my body, and what I'm here to do. So I think it's problematic when we start to operate from these positions that we have. And I include myself in it as a psychotherapist, where I was trained and what I was taught to say and how we shorthand for things. Like I worked in child welfare for many years, and it would be like the bio mom and the birth dad and the humanity just stripped from people. So when I think about systems, I think about opportunities for us to make them more community oriented and connected culturally. And I get this from Chanel Portia from Ancient Song Doula Services. She talks about cultural humility, just being able to slow yourself down and recognize that you have to meet that other person where they're at instead of trying to drag them over into your space, which our spaces can be really wonky and crazy sometimes. And I'm telling you, I'm saying this because I've worked in systems and structures before I left for many, many years, and just how we operated in this systemic madness created dis-ease for ourselves as the providers in the space, and then also it trickled down to the community. So, as someone who has been a person who's experienced postpartum depression and psychoses in my lifetime, like I had 3 children postpartum depression with all of them. With my second daughter was very serious and contemplated harming her and myself. And I'm grateful that I'm here and that didn't happen, but I had to push through on my own because systems didn't ask me questions after I went through preterm labor, after my baby was born with a birth defect and needed a surgery, in the hospital for 30 days, under heavy medication for her healing. And they just sent me with the baby home at 21 years old. And it's like, see ya, and didn't ask if I was okay and how I was managing the trauma. And that, my daughter's now 34, my second daughter, and it's still happening. What is that? So we really, really need to transform how we negotiate human to human dynamics and get off the pedestals that we put ourselves on and come, I won't even say come down. We need to actually rise up to where the community is. I'll switch that. I'll say this last thing. I'm privileged, and I love that Kimberly talked about privilege, to be in a documentary about my daughter's life. But I want to point out that my daughter, she was great. She's awesome. And she also had her flaws. But there are women who are in drug treatment programs or recovery programs. There are women in getting psychiatric support and birthing people, and they need to be honored and lifted up, just like my daughter would be honored and lifted up, and any other, like Shalon and all the others. And I think the system has failed folk when they decide that you're not worthy of the time, the attention, and the resources needed to make sure that you get quality care and that you're treated like a human being.
I appreciate you sharing that, and also talking about something that's often taboo in our community, and that's when we struggle with our mental health. And not understanding that your physical health and your mental health are tied together. I mean, I don't know too many people that are just bright and sunshiny when they're in pain and they're hurting because their back hurt, their tooth hurts, their feet hurt, and that's the simple things. And so the more we start to acknowledge how much stress and trauma and how all those things can come together and really wear us down, and also the aspect of grief and how we process through grief. I will say, and for Miss Wanda Irving, it's one of the things that I have personally admired so much about you is that your willingness to show your grief, but also show your power in your grieving. And for those people that may have had these types of experiences, are you comfortable just speaking a little bit to how that has been for you?
Sure, thank you for the question. Grief is forever. That's one thing I had to accept. And I'm never going to get over it, but I can get through it. I had 3 children, lost all 3 children. Shalon was my last child. It's a matter of wanting, with Shalon, it was a matter of wanting her death not to be in vain because it was preventable. It didn't have to happen. And I wanted to make sure that people understood that and that I respected her memory. I gave respect to the love that she had for me and I had for her. And I wanted to be there to share with others about that. It's not an easy trip. It's definitely very traumatic. But it's something that I felt had to be done. And I continue down that road to make sure that I give honor to her legacy and what she was about, what she stood for. And that is what keeps me going on that road.
Thank you so much for that. I think, again, there is happiness, there is joy, but we also acknowledge trauma, we acknowledge grief, and we acknowledge the power and the resilience it takes to put all of those things together and say, it will be better. And I think that's what I admire about what each of you are doing. Now, we have a little bit of time left, and I know how quickly that little bit of time goes. So I want to pivot back to Dr. Farrington and maybe have her review the act just one more time for people. And maybe if you can, Dr. Farrington, slow down a little bit, make it as plain as possible, because I want us to kind of do a round robin and really give people concrete, if this, say this. These are resources that I have that I think you should use, because I want people to know that they can walk away with a few immediate tools for how they advocate for themselves, how they push against the system, how they connect with other communities that are here to support them. So Dr. Ferriton, let me pivot to you first, and then I'll go around to each of our other panelists.
Okay, had to unmute. When we have we have lists of things to do, what to say, how, for example, if you disagree and they're pushing you, they're pressuring you, you're concerned. Now we're concerned about the fact that that Child Protective Services is called on people for minor things, and we're concerned about the fear that my partner will be put out of the hospital. You know, a fear that Kira Johnson had before she passed away and told her husband Charles to calm down. So what we have done is, after everyone shares what they would say or do, we have a list of things that you can do, such as, and we'll give you wanted concrete examples. Say to the provider who's saying they want to do something to you on labor and delivery, say, would you please give us space? We want to pray on that. My husband and I want to pray on that. Drop the names of the higher ups in that hospital, that department. We also say, I want it noted in the chart that you are refusing to provide care. So we have a lot of ways to work the system that we work into our workshops, and the list goes on. You can bring in the American College of OBGYN statement that you have a right of refusal of recommended treatment. You can show the Hospital Bill of Rights. I put in the chat the Black Birthing Bill of Rights from the National Association for the Advancement of Black Birth, the Southern Birth Justice Bill of Rights also. So there are a lot of resources. There's now a tool called the Induction of Labor versus Spontaneous Labor Decision Aid. You can bring in the decision aid, and they even have an app for it now. Then you can go over that with your obstetrician and go through it step by step and say, you know, I think according to this decision aid and my preferences, because you want to emphasize what you prefer, because it's your body, your pregnancy, and you should think no decision about me without me. So there's this new decision tool. There's going to be a whole program during this week, and I think we're going to put that in the chat. There's options and opinions. So they're going to talk about in that the decision aid around induction of labor, because that's so common. And there's videos on our website of people who push back on having a C-section and saying, you know, how's the baby's heartbeat? I think that you said the heartbeat is fine, but you're telling me you want to do a C-section because the baby's too big? You don't even know how big the baby is. So there's a whole range of things that we go over in our workshop. And our next workshop is ACT for dads. We're including dads next time. So it's not just a matter of, we know that people are getting terrible pushback when they try to speak up, and getting harmed in spite of it. But we're saying, mobilize your supports before you go in, and take this toolkit with you before then, so that you have more power to confront that pushback that goes on because of this, what I call obstetric supremacy. They just think they know better, and so I'll stop there.
Yeah,
Thank you for stopping me.
And I appreciate you mentioning, because there was a question in the in our Q&A about how Black men can assist with like doula work or participate in advocacy outside of just for our sisters, mothers, and spouses. And so
Be there. They need to show up. They need to be. They can be on the phone. You can say, my partner wants to know blah blah blah. So they're there.
Shop that you're going to be doing. And so I think that's another great thing. People are also putting other responses in the chat. So thank you so much for that. I told you this time was going to go fast. So let me flip on my little Hollywood Squares. Hopefully there are other people old enough on the call to remember Hollywood Squares. Jay, may I go to you and maybe talk about how you approach your resources and maybe concrete advice that you give people, having that support person. Don't ever be alone. Write things down. Some of the things I know Dr. Farrington has touched on, but what you found as well.
Yeah, just to really elaborate more on the emphasis of having fathers and partners in the room and a part of the conversation, that really helps to strengthen those dynamics of understanding everybody's role in the birth and the safety of that mom and the birthing person and that baby. We also, excuse me, do a lot of emphasis on using apps and using our honestly using our smartphones to document things that are happening. Again, connecting with all of our partners and creating really strong partnerships and these collaborative spaces that really has helped to build more trust in our communities, but also give them more resources. Something I love to tell everybody is find a resource, be a resource. So even if this isn't something that applies to you or in the experiences that you are currently having, you may be the resource that another mom or birthing person or even father is looking for at another time, right? So I always tell people about the Earth app. I always tell people to go to melanatedmoms.com. I'm always telling people to check our social media because these are the very common places that people do already look for education and information. But if they know that it's coming from a valid place and a valid person that's been doing this work and that's so invested and committed to it, then they are again going to be the next person that's going to pass the baton so that it gets to the right people. Lastly, our resource list and our directory list, it comes from the partnerships that we've made, but it only can continue to grow when people are asking, hey, can we be on your resource list? Or how can we add more to what it is that you're building? So we're always looking for new partners. We're always looking for more collaborators so we can make this space more robust and make it look like us. Because the last thing that I definitely want to make sure that we point out when we're saying that we want to create safety and remove all of this harm from Black and brown spaces, we also want to put in providers who look like us, people who are activated in this space, who really want you to know that we do exist. We're not just, these anomalies that exist. 1 in 10,000 people are, in this space. This entire panel is full of Black women. And I think that's a powerful statement, not just as words, but literally as a visual aid to let people know that we are here as your resource. So, just continuing to push for that. Again, giving them that space that they know that they need to feel comfortable in asking for those types of resources. And again, find a resource and then be that resource.
Thank you. Ms. Wanda Irving, may I pivot to you now?
Yes. I'm sorry, I was so distracted. Your question once again is,
Oh, absolutely. So just in kind of wrapping up, what are some specific resources that you have found to be very helpful? If you want to reference what Grams is doing, or just from your own experience, something that you could share, just a couple of points that you think would really help our communities.
I think working in collaboration is something that I've found to be very helpful. As I think it was Shawnee said, we can't do this work alone. And I'm really proud to be able to work with amazing women like the ones that are here and talking and sharing and collaborating and canoodling, however you want to put it. But knowing that we all bring something special to the table and being able to talk with each other and leverage our resources to move forward. I think that is key to where getting us to where we want to be. And with Graham's, what I'm looking at there is that we as grandmothers, I know myself and several others that I've talked to, when we first lost our daughters, we were just totally lost. We didn't know what to do, where to go, how to get the answers, where was the resources, how are we going to navigate this whole new birthing or parenting experience in this day and time, which is so much different from 40 years ago when I was raising 7-year-olds. And so it took a lot of a lot of collaborating and saying, okay, what are some of the key points here? What is it that we need to know? What is it that we need to do? How do we better prepare a path for women like us who are going through this or who will be going through this? And how do we also protect the children? That's something that's really key to me. And when I look back, my daughter's dissertation was on how trauma in childhood affects adult health. And so that to me was like a sign. We need to be more worried about these children that are surviving maternal mortality and what's going to happen to them. I was talking to a gentleman just yesterday, and he was telling me how his adult child she was 15 at the time, she's 18 now, but how she tried to kill herself 2 or 3 times because of that trauma that wasn't addressed. And he said, I just feel helpless. I don't know what to do, how to reach her. And there are more parents like that. And so that's what we're doing with Grams, is trying to really build that community, trying to put together the resources, the information, the community, the network, so that we can, in fact, help others get through this.
So thank you so much for adding your words. Kimberly and Shawnee, I don't mean to shortchange you, but I see that I only have 1 minute left. See, even though I said I was going to make time, it always flies by. Now, I am required to make a few important housekeeping announcements, but for those that are able to stay over maybe a couple of minutes, then we can formally wrap up by just being reminded of the amazing work and resources that Kimberly and Shawnee offer. We are just starting Black Maternal Health Week. All of our resources will be free. Our next workshop actually starts in approximately 30 minutes because we recognize people have different schedules, and asking you to always be available when we're available doesn't make sense. So in 30 minutes, we'll have Birthplace 411, discussions on birthing options. You've probably heard, things about home births or hospital deliveries or deliveries at a birthing center, and what you need to know, what your state laws, federal laws, what we recommend. So if you can, we have the link that you can speaker births now. We would love to have you, and please continue to join us throughout the week as we continue to have these important conversations. I tried really hard to get through as much as I could in 1 hour, but for me, I want you to see these amazing and to know that you don't have to stay in your grief, you don't have to stay in your trauma. We come together to be empowered, to change, to bring joy to our families, to our communities. And please use these very real resources that we shared throughout tonight. And I want to thank each one of you for being friends, for being co-conspirators, for showing up in this space. I want to thank the men that chimed in, because yes, we need you. I'm going to end on a slightly controversial note. What I would ask all of you to do is register, because we not only need healthcare professionals that look like us, we need people who make the budgets and sign the laws to do us right, and to vote those people into office. So thank you so much, and have a wonderful evening.